She's going to be somebody that you're going to want to support, somebody you're going to want to be able to stand and make sure that she knows that you're on her side and she's not alone. Okay, I'm excited, all right, to bring on board as a special guest tonight for Warriors Quest, Gretchen Jackson. All right, man, I'm excited to bring her on board. Gretchen, I'm bringing you on now. Welcome to Warriors Quest.
Hello, Jared, and thank you so much. Thank you so much for advocating for me. I'm doing well
You're welcome.
tonight.
It's my pleasure. My pleasure. That's good to hear. Now, I'm excited to get your story told, to get your voice heard, and have everybody, get to know you. Can you let our followers know a little bit about where you come from? You come from Alabama, but tell our customers a little bit about yourself.
Sure. Well, my name is Gretchen Jackson, and I'm from Tuskegee, Alabama, born and raised. I have one 21-year-old daughter who attends the Tuskegee University College in Tuskegee, Alabama, majoring in occupational therapist, and her mother is in need of a kidney. I was diagnosed with FSGS in 2014, a rare kidney disease. Don't know where it come from, never heard of it. Doctor said ain't no cure for it, but at some point I would need a transplant, and now it's the time that I need a kidney transplant. And I'm just here to reach out, asking for help. Anybody who would like to just share their spare kidney, I would be greatly appreciated of it, because we can't live with one kidney. We can live a healthy life with one kidney. And I just hoping and praying that someone would be able to share their spare kidney with me. I come from a family who have kidney disease. My dad's side and my mother's side. I had an aunt who was in renal failure. She was on dialysis. She received a kidney transplant, but she died a few years ago. My dad, I'm currently my dad caretaker. He's a total disabled veteran, blind. I see about my dad, and my dad is also in renal failure in his own dialysis. He's on hemodialysis. So I'm just hoping and praying that I can get a kidney transplant here soon so that I can get my life back. I feel like part of my life have left me because my time is limited now. When I was in school when all of a sudden this kidney disease just took over and made me very sick back here in March of last year.
When did you find out that you had the FSGS? When were you diagnosed with that?
I was diagnosed with FSGS in 2014.
2014, okay.
I began swelling. Didn't know why I was swelling. I thought it was coming from me working out because I was doing a lot of workout with me and a friend.
Okay.
Started swelling in my feet, my ankles, my legs, and it was painful. I didn't know what was going on. I went in to see my primary care doctor. He did all these kind of tests, and he still didn't know what was wrong. He said, well, I'm going to send you to a nephrologist. I said, what is a nephrologist? He said, that's
right.
specialist. He said, because I want to know why you swelling and why you got so much protein in your urine. I said, okay. And of course, at that time, it was 6 months out before I seen this kidney specialist, but he gave me a
so you had to wait 6 months to see the specialist.
I had to wait 6 months to see that kidney specialist, but my primary care provider prescribed me a LASIK, which helped reduce the swelling. And it really did make the swelling go down. So when I went to see the nephrologist, I didn't have no swelling.
So you thought, okay, man, this is okay.
It's okay. Oh, it's gone. The problem is solved with the LASIK. But oh no, That nephrologist did more tests and more tests, repeat the urinalysis, and he said, Miss Jackson, this just ain't right here. You got too much protein in your urine. He said, you only 34 years old. What? Something ain't right. He said, I'm gonna have to do a kidney biopsy to see what is going on with your kidneys. And so he did do a kidney biopsy. 2014, the kidney biopsy came back that I had FSGS.
Wow. So, man, I'm just still trying to get over that. So, you had to wait 6 months. They did give you something to minimize the swelling, and that worked.
Right.
But during that time, I mean, something, that concerns me that you had to wait 6 months. But nonetheless, they gave you something to minimize the swelling. You felt better. You thought you were out of the woods. And then as it got closer to your appointment with the nephrologist, how were you still feeling? Were you still feeling well?
I was still feeling well. Didn't have any other symptoms. That LASIK had stopped the swelling. I didn't have any symptoms.
Okay. Yeah. Steve's saying they didn't give her the medication to block the protein spilling. Okay. So
No, the primary care doctor didn't give me anything to block the protein spilling.
yes.
I had to wait to see the nephrologist. And when I seen that nephrologist, he did that kidney biopsy, came back FSGS. He began to treat me with lisinopril to control my blood pressure.
For your blood pressure, right?
Take that lisinopril. That lisinopril made me cough real bad. So I started taking that. Then he prescribed me Losartan, and I kept taking the Losartan. And the Losartan was supposed to help the protein from spilling in my urine, is what my nephrologist said.
Right. Yeah. So when their first doctor had noticed the protein in your urine, how concerned did he seem, or he or she? I forget whether you said it was a he or she, but obviously there was a little concern because he asked you to see a specialist, a nephrologist, and to everybody else, especially to me, before I knew about kidney disease, I didn't know what a nephrologist was either. But how concerned was the doctor about seeing protein in your urine?
He was concerned because he set me up appointments with two nephrologists. Dr. Garrett Jones was the first nephrologist who had the quickest appointment. The other nephrologist appointment wasn't until way sometime first fall. So I saw Dr. Jones. He was very concerned because he just started asking me all type of questions like, do you drink protein drinks? Do you eat protein bars? Do you make protein shakes? I mean, how much of exercising are you doing?
All right. He was on point then.
Very concerned. Yeah. But he was telling me that he think that I would have been all right, but on the safe side, he just wanted me to see the nephrologist.
Okay, all right.
Yeah, and I think at that time my creatinine was running about 1.8, 1.9, close to the twos or something like that.
It's not bad.
And after we did that kidney biopsy and he started treating me with that lisinopril, which didn't work, and then the Losartan, I followed him every 6 months to do blood work, renal panels, and him just checking the swelling and checking my creatinine and my BUN and all of that. Everything was just fine until 2018. At some of my visits, my creatinine would be elevated, so he would repeat the renal panel. Okay. Ms. Jackson, don't get discouraged yet. We're not talking about dialysis or anything like that. But he said to bring you out of this, you will need a kidney transplant soon.
Okay. So he was
trying to get
you prepared.
Get me prepared. And he was trying to get it to where I didn't have to go on dialysis. He was trying to get me a kidney transplant before I had to begin dialysis.
All right.
But
I like this
it
doctor.
doesn't
I like
work
this
that
doctor.
way.
Yeah.
It doesn't
I
work
like
that
it.
way. They say you
Yeah.
have to be on dialysis before you can get on the kidney transplant list. That's what both clinics told me, UAB and Piedmont Atlanta.
Really?
Yeah. Because I even had went a year before I began getting sick and having to go on dialysis. I went to do my evaluation process a year before, the summer of 2018, before I got sick.
So do you still see the same nephrologist then?
I still see the same nephrologist. That's Dr. Gerald Jones out of Montgomery, Alabama.
All
Great
right.
doctor. Yeah.
It sounds like it. Yeah. So, the lisinopril sounded like, Steve just mentioned it in his comment, and it's common for high blood pressure, but it sounds like you had a poor reaction to it, right?
Yeah, I had a poor reaction to it. It just made me cough. I had a dry cough with it. I couldn't take it. That was the very first one. And then I went to Losartan. That made my hair fall out.
Oh my gosh, really?
Couldn't take that one. Then I moved to Valsartan. Valsartan seemed to work it a little better than the other two did.
Okay. And so the idea behind lowering your blood pressure was that was going to help try to slow down the FSGS, or what was their direction they were trying to give you?
Okay, cause like I said on our little run last night, I don't have high blood pressure. I don't have diabetes.
Right.
The blood pressure medication was to control my blood pressure, not make my blood pressure get elevated because of my kidneys wasn't working well, poor function,
Right.
and to stop the protein from spilling in my urine is what I was told. That's what they were for.
All right. So that was their direction, and that's why they were trying to give you the high blood pressure medicine. Okay.
Right.
All right.
Right.
Wow. So man, so you've in 2018 is when it started coming to a head, though. Can you kind of give us continue your story about that and kind of explain what happened in 2018 that kind of took a turn?
Okay, in 2018, my creatinine was just being elevated. It was being elevated. So I can't exactly remember the numbers, but it was elevated. So he wanted me to start thinking about treatment. So I went to a class that was given at his facility to talk about different treatment options.
Okay.
Went to that class. And talked about the different options for treatment. If I ever had to go on treatment, I chose PD. And I was able to go up to UAB Birmingham to meet with the nephrologist there, to talk about the transplant process and start the evaluation. So that's what I did.
Wow.
But they
what I do like it.
I'm sorry.
They didn't.
I'm sorry.
Okay, we got cut off just a little bit. It may have been it may have been the internet connection, but there was a little bit of a cut off. I apologize. So what I really do like is it sounds like your nephrologist was giving you options and talking about the different modalities of dialysis, and I like that because unfortunately that's not always the case with many kidney warriors. Many times they just tell them they put a catheter in them without even talking about modalities. And then they say, we're going to schedule surgery for a fistula later, and So the fact that they're discussing modalities and talking to you about different, different ways to have dialysis, man, that's impressive that your nephrologist has done that.
Yeah.
What was it about peritoneal, PD that kind of caught your attention, or why did you choose that over the others?
For one, I don't like needles.
Okay.
I just don't think I would have last if at that time, if that was the only option. I don't think I would have last, because you go in the center 3 times a week.
Yeah.
They for one, they put that shunt in your arm. Then you have a big Bucky graft in your arm.
Right.
Then you go in the center 3 times a day. I mean, 3 times a week, and they connect one needle to the venous and one to the artery to pull all the blood out of your body, and then they put it back in. I don't think I could have did that. And then with the PD, it gives you a little bit more freedom. You're able to do some things that you no capable and normal of doing, like work. I still work. A lot of people who do hemodialysis, they don't work. And I knew I had a family to take care. My daughter in school, I was in school, and I still had to provide for my family. So that was one of the reasons that I chose PD. And also they said PD is less stress on the body. So that was another reason why I chose PD. And just give me a little bit more laid back freedom time. Did I do my homework? Yes, I did my homework on PD. Or what homework are you talking about, Lisa? Can I type over here? Jared. Are you there, Jared? Jared. Jared.
Yeah, so you basically you chose PD, and you're saying that it's giving you more freedom.
Right. It's giving me more freedom to do the things that I would like to do, but it's still kind of limited because my time is 8 hours to run, and I have to make sure I run those 8 hours.
Okay. All right. So the 8 hours, of course, with PD, you're doing that most of the time when you're sleeping, and then you're alerted when something happens.
Correct.
You had the training. They did training for you, before you could do the PD.
Right.
How comfortable are you, and how do you like the control of doing that on your own?
Well, now when I first had the training, I didn't think I was going to be able to do it either. I was like, I don't know if I might do something wrong and something may go wrong. I mean, I just don't know if I'm going to be able to do this. So I did it in the center for a week with the nurse. And then she also came out to my house twice.
Really? Okay.
And so when we did it at home, it was kind of just like a run through. It was like I kind of grasped it pretty quick. I did grasp it pretty quick. And I was like, okay, so I can set this up, and it's like I'm being my own nurse.
Yeah.
Everything has to be sanitized and clean to reduce the risk of getting peritoneal infection.
Okay.
So you like I said, I'm my own nurse. I weigh myself. I do my own vital signs, clean my machine, and just hook up. So it's
awesome. Yeah, and it sounds like you were able to grasp it pretty well, pretty quickly. Do you think it's because they did a good job of training you in center, before they
Yes,
went to your house? Okay.
yes. They really did do a good job in center training me.
Uh-huh. Who did the training for you?
The training was done by one of the nurses at the peritoneal dialysis home center. Her
Okay.
name is Leslie. Sweet nurses.
Uh-huh.
I have some sweet nurses there. I see them twice a month.
Okay. So you go there twice a month and
I go there twice a month. They do labs. And the second visit is for me to see the nephrologist and talk with the social worker.
okay. All right. And how often when do you get your boxes from Baxter, or
My
all of
box,
this?
my boxes come from True Blue. They
Okay,
come,
True Blue.
they come every third week of the month.
Uh-huh.
Yeah, they call me and ask me, am I ready to place my order? And I place my order, and they deliver it here, and they set everything up for me.
Wow. They even
Some
set it up for
amazing
you.
people.
Very cool. And how is everything coming along when you do go when you go there twice a week and you visit with them, and then you see the social worker? How has that made you feel? Has it helped you, or do you feel like maybe you're going there and it's just a routine?
Now, when I first started going, I was very depressed. I was depressed
Mm-hmm.
because it just it just made me feel depressed knowing
Sure.
that this is something that I'm going to have to go through until I get transplanted. I just
Right.
kind of felt like part of my life was leaving me, but I knew I had to do this to remain healthy and continue to remain living until I get
Mm-hmm.
transplanted. So
Right.
when I go there, um, my visits are good. Sometimes something could be a little bit off with one of my labs, like my phosphorus or something could be a little bit high, and that's because
Mm-hmm.
I sometimes forget to take my binders
The
when I eat.
binders. Yeah.
Those
Okay.
big old fat pills that I
Yeah.
hate to
They are
swallow.
big, aren't they?
3
Yeah.
of them every time you eat something.
Uh-huh.
um, Sometimes my albumin be down. I think they want it to be they want it to be like at goal is a 5.
Is it 5?
Sometimes I be 3, 4.
Okay.
Sometimes I be 4, 2. But they want it to be at 5. Your albumin level, that's enough, getting enough protein so that your blood could be healthy. So those are the main two that be kind of off sometime. But this past week I saw my nephrologist last week on the 19th, and my albumin was low, but everything
Really?
else was fine.
And
Hmm
did they say why they thought your albumin level was low?
Um, just need to eat more protein.
Okay. All
Need to
right.
eat more
So nothing
protein.
necessarily out of the ordinary, just that your
No,
protein
nothing necessary out of the
protein intake
ordinary.
may have been a
Just
little
need
low.
to eat more protein.
Uh-huh.
Hmm
Okay.
Yeah. So here I am. I'm just
Well, the
here.
diet with PD, your diet with PD, can you tell us a little bit about maybe what they've instructed you to eat, and maybe what you normally eat on a regular basis when you're doing PD?
Well, really don't have a lot of restrictions on PD because you cleaning yourself every day. You can drink more fluids than a hemodialysis patient does. Um, with PD, they do want you to eat a a low sodium diet. Try not to have too much of sodium, but it's really not a limited on PD. Only to watch your sodium intake and watch things that are high in phosphorus. But other than that, that's it.
Okay.
When I go in, I'm never overweighted or anything like that. So it's really not a big diet on PD. PD can have more than hemodialysis patients
Yeah.
can. Mm-hmm.
Okay. Yeah, I like. Thank you for talking about that. That's always interests me to hear the differences. And have you ever been concerned about maybe the infection, peritonitis, or has that never been an issue because you clean that well?
Well, only issue that have only concerned me is if I'm around somebody who's sick. It's the only concern that I have with that peritonitis.
Mm-hmm.
Because otherwise, I know that I keep my house clean and I'm going to keep this area clean that I'm in doing my treatment.
Yeah.
So I don't worry about that too much. But some people I've heard just have got peritonitis and they have been clean. I mean, I
Yeah.
don't know. But
Uh-huh.
I try to be very cautious of, environments that I go in and try not to be around people who are sick because I know my immune system is low already.
Right.
Yeah.
Good
Now,
for you.
I did get scared back here April of last year. I was actually dressing my site and I accidentally cut the tube, the
You
part that
did.
goes inside my stomach. So
Uh-huh.
I was
What?
very scared that I was going to
Yeah.
get peritonitis. So
Uh-huh.
I called my own call nurse and she was like, get to the emergency room quick, get to the emergency room quick.
Wow.
Because if you don't, you can get peritonitis. You can get peritonitis. And so that did kind of scare me at that time. But
Sure.
I haven't had any problems with it. And I have had this PD-CAF since April of 2019. And I
Uh-huh.
began treatment in May of 2019. So it's
Okay.
going pretty well, but I'm just kind of tired of it. It get aggravating sometimes and it get depressing sometimes.
Sure.
But
Right.
I'm just keep holding on and trusting in the Lord that He's gonna send me a healthy kidney very soon, and all this gonna be over with after a while.
Well, I like that. Because I understand it's not always easy. What you're
No, it's
going
not.
through,
Some
what you're,
days I have good days and some days I have bad days, but I thank God I have more good days than I do bad.
amen, amen to that. Count your blessings and count and look at the as many positive things as you can. Uh, but I do understand. I can only try to imagine how difficult your journey is, Gretchen. And I admire you. I admire your toughness and your strength because it's not easy. What you're going through can sometimes, some days, put you down to your knees because of how difficult and overwhelming it may seem to you. And
Right.
so I, I'm thankful that you faith, and I encourage you to continue to use your faith. That God won't abandon you, and God will continue to watch over you and protect you. What's my next question is what I want to kind of talk about is you know how does this make you feel? How does kidney disease make you feel on a daily basis? Can you help the followers help you? Can you help them understand how it's changed your life and how it makes you feel regularly?
It depressed me sometimes.
Yeah.
It depressed me sometimes because of the things that I go through. Sometimes I just don't feel good.
Mm-hmm.
And I know that's not me because overall I'm a healthy person. I just have this kidney disease and it
Yeah.
just sometimes depresses me. And when I get into that depressing state, I just have to I have to go to the master in prayer
Mm-hmm.
and ask him to deliver me.
Amen.
Because I know that it's gonna be soon that somebody gonna hear my story and want to share their spare kidney with me. It does make me feel depressed sometimes.
Sure.
Sometimes I don't feel like being bothered. I don't feel like doing anything. Sometimes I don't even feel like going to work.
Yeah.
But I just have to just pray about it and keep on going.
Move forward. And it's, and I appreciate you being candid and speaking about how it makes you feel, talking about your feelings. I appreciate you doing that, even though it's not easy. It's, it's natural for this to make you feel depressed and to make you feel, down, and those feelings are real. And I want everyone to understand that that even though you feel those feelings, I want everyone else to to hear this from you, because I want everyone to give you as much support as possible. As all the kidney warriors that are connected with kidney disease, many of them understand what you're going through. Okay. And they understand because they felt depressed. Many of them have felt fatigued, and they felt all the same symptoms and whatnot. And then other people that don't have kidney disease, many of them have had some hardships in their lives and they felt depression. It is real, and it can make you feel sometimes less. But
Yeah.
we're going to rally around you. All right. This is a big community, and we're going to give you the support that you need. We've got everybody from the Urban Health Outreach Media Network that's going to give you support. Lisa Baxter will, I will, Steve Belcher, anybody else that's in and around the kidney disease community will give you support. And we're not going to make you feel that you're on your own, because you're not. And God is not going to leave you alone either. Yeah, Steve just put here, and it's a great comment. You have a new family for support, Gretchen, and you do.
Thank you.
We have a great umbrella, and we'll use it, and we'll give you, and we'll make sure that you can make, that we're accessible. You can hit me up, you can message me, and we're going to send this out and reach as many people as possible so that we can have people understand and hopefully get the compassion that's necessary, because I'm truly touched by your emotions. And I hope that everybody else who's watching this is also, feeling stirred, enough to share this, to also share this in large Facebook groups, to share it with their friends and their family, because many people have been living kidney donors, and they live very normal lives.
Right.
And you said that earlier in the show, and I want to mimic that, is that, many people can live extremely normal lives and do the very same things, or, that they were doing before. Many of them are cyclists. Many of them are doing fitness. Many of them go to the gym. Many of them say and tell us that they feel like they did before they donated, and they don't feel any different. And so I'm really, really passionate about having somebody step forward for you. And I hope everybody else feels just as passionate as I do. I want that badly. I really do. Because you deserve to feel like you're somebody. You are somebody. Yeah. You do have worth.
Yes.
When you have feelings, when you're down and you have a day that's off, what are some things that maybe you've done to get you back up, to lift you up? Do you listen to music, or do you have maybe family members that give you support?
I talk to family members. I talk to friends. I listen to gospel music. I read scriptures,
Amen.
and that kind of gives me some support, lifts me back up.
All right. I like
Yeah.
that. What what kind of gospel singers do you listen to? Um, I'm not like totally. I don't know all of them, but maybe I've heard of a couple if you name some.
um, I like Rance Allen. I
Okay.
like the Carrington Spirituals. I
All
like
right.
the Mississippi Mass Choir.
Mm-hmm.
It's several of them that I listen to. I just log into my Pandora account and
Mm-hmm.
just play gospel music. But there's
Right on.
several different gospel artists that I like to listen to. Uh,
Nice.
Carrington Spirituals and Rance Allen are my two favorites.
Mm-hmm.
Hmm.
Great. That's great. That's a great idea. Music can be uplifting, especially gospel
Yes,
music.
it's very uplifting. It really does
Yeah.
lift me up when I listen to some gospel. Really
Very
does.
nice. Now, when you listen to that gospel music, Gretchen, does it make you feel as though some of your problems are on the wayside? Does it make you kind of forget or at least not focused on some of the bad things?
It make me not focus on the bad things. It
Yeah.
make me not focus on this kidney disease as
Uh-huh.
much. Because I can listen to my music and I can rejoice and I can sing and I can just have a hallelujah good time in my own house. Even if I'm
Mm-hmm.
at work sometime and I'm feeling down, I plug in my earbuds and turn on me some gospel music and get to singing sometime. My next door neighbor like, are you over there in the spirit, are you?
Nice.
Sometimes they can see the tears rolling down my eyes.
Yeah.
They know that I'm going
They've,
through something.
yeah.
They don't know exactly what because I
Well,
haven't told a lot of my
sure.
peers at work, but they
Okay.
pretty much know because I
They know
don't
something.
something is going on, something
Yeah.
is not right with me.
Mm-hmm.
But it really does when I listen to gospel and read scriptures, it uplifts me.
Very nice. Well,
And I
continue
can
to do
call
that.
my uncle and talk to my uncle.
Yeah.
He's a deacon in the church, and
Uh-huh.
he will quote some scriptures with me and pray with me over the phone, and we'll sing a song over the phone, and just that really does touches me, make me feel better.
Nice. Very nice. Well, and I'm not sure which passages or which scriptures in the Bible are your favorites, but I love the Sermon on the Mount. Okay, and you can find that like in you can find that in a couple of epistles, but find whatever it is that maybe is going to is going to resonate with you. Maybe you have you know a certain scripture that's a go-to scripture, whatever it might be. Go to it like whenever you're having some sort of depression or whenever you're having a bad day,
Mhm.
and then turn on your Pandora and listen to some of that gospel music. Continue to do that.
Right.
When you're listening to some of the gospel music, do they ever sing "How Great Thou Art"?
Um, not unless I actually play that.
Okay.
Yeah.
Well, that song is one of my personal favorites. See, my dad died of cancer back in 1993, but before he passed, he actually played the piano and sang. And one of the songs I can still hear in my mind is my dad singing "How Great Thou
Great
Art."
there.
That's right. Yeah, I can hear him playing the piano and
Okay.
singing that song. And so on one of my bad days, that's something that I try to listen to in my own mind since he can't play it anymore, but I can still
Mhm.
hear his voice. It just means a lot to me when I hear that song. But
Mhm.
what are some of your favorite, gospel songs that you hear and put on Pandora from these bands, these gospel singers?
Um, you just put me on the spot.
That's all right.
Oh wow. What's the oh man, it's on the tip of my tongue. Um wow. I can't even really
You're
think
all
right
right.
now.
Sometimes that happens. Yeah, and I put you on the spot. That's okay.
She
And then
Ella said you
Pamela
like
saying Rance,
Alan.
Rance Allen, Leandra Johnson are her favorites. That's nice.
Yeah.
All right. So, and then Jeff Hartley's been listening. He's been watching. He says your experience and hope will be passed on to others. So he's a great living kidney donor himself and a great advocate. Do I still have you losing?
Are you there? Jared.
Yeah, I'm sorry. I'm back.
Okay.
So, anyway, I love that you do that. I encourage you to continue to listen to music, do those things that you're talking about when you're having some off days. And the amazing thing that I've learned about you is that you still work, and that's impressive.
I still work. I work an 8-hour shift, and sometimes I work 10 hours.
Yeah, wow. Not many kidney warriors do because of how it makes them feel and what happens.
I've heard it. I have heard it make you. Some kidney warriors, they are very tired, they're exhausted, and they don't feel like doing anything. And sometimes I get like that.
Okay.
But I just thank God that I am still able to get up and go to work.
Yeah, and I can't say for certain, but I'm thinking maybe the peritoneal, the PD, it may have something to do with that. Many people say that they feel better when they're on that versus in center. Many people said that. So wow, and not only do you work, but you still, you're doing things, and I want to commend you. Okay, doing PD sometimes can be a little overwhelming, and at first you said it even was a little, man, can I really do this? But I want to applaud and commend you because doing that and you're watching everything and you're cleaning it and you haven't gotten peritonitis. That's impressive. I want to say that because to do that all on your own is very impressive. And and it sounds like you're Johnny on the spot, so to speak, where you're looking at your numbers and everything.
Yeah.
And so how important is it for you to make sure that you're doing those things? Have you ever had an alert while you're sleeping to let you know something's off?
Yeah, I have had an alert. It could be patient line blocked. That could mean that you're laying on the line or something that's going on internal that's could be the tube could be rubbing up against something. Sometimes people could be constipated or something like that would make the alarm say patient line is blocked. And those just about the only alarms I get, patient line blocked. So I jump up and I twerk or twist or do something to make sure the line is not blocked.
So it just clears it up. Was that pretty? Did that make you a little nervous with the first time it went off, though?
Oh yeah. Woo. I said, what the world is going
on? Right. Yeah.
I didn't know what was going on. I had called an on-call nurse, and she said, "Oh, you just got an alarm." She said, "Maybe you laid on it or did something." And so they walked me through how to get their alarm off.
Okay. and now it's like routine where it's like, oh, okay, that's done that before, no biggie.
Right.
Okay.
Yeah. Mm-hmm.
Well, you mentioned that you haven't told many of your coworkers that you have kidney disease, but they do see that you've broken down and you've gotten emotional and you've cried. Is it because that what? Can I ask you why it is that you haven't shared that information with them? Are you afraid that maybe your job will look at you differently?
Not really look at me differently, but when I first got hired, because I work for the Department of Veteran Affairs. When I first got hired there, went through the NEO, which is the new hire training process, and they were saying in that new hire training, you want to kind of like keep most of your personal business away from the job. So that's one reason why they don't want you, and especially health. They don't want you sharing your health with somebody else, and then the whole entire facility know that you got something going on. So that was one reason why I just kept it kind of hidden away from coworkers. But it's one coworker who I talk to often, that, and she knows about it because she is the one who helped me out to my car that day. I got the call saying that I needed to get to the emergency room ASAP. Yeah. So I let her knew what was going on with me at that time.
Okay.
And actually, she was the one who drove me to the emergency room that day.
Mm-hmm.
Because I was just upset and I couldn't drive myself.
Okay. It can be very upsetting, especially when you're thinking you've got to go to the emergency room because of what, your kidney disease. That can be very upsetting. I can totally understand how that would be a very emotional sort of moment for you.
Right.
Now, when you learned that you had kidney disease, and then a little bit as you started understanding that this is something you're going to have to live with, who are some people that you've connected with, online or in the kidney disease community that have, that really welcomed you with some really good support that have been instrumental in regards to you feeling like maybe you've got, a fighter's chance at this?
Okay, now when I first found out about it in 2014, I didn't reach out to anybody.
Okay.
And because it hadn't had progressed.
Mm-hmm.
But in 2019 is when I started going to the home dialysis center. Mm-hmm. I met Miss Verna Johnson, who also is a kidney warrior.
Yes.
And we talked, and we talked, and we became friends.
How did you meet her?
I met Miss Verna from coming to the same. We see the same nephrologist. So
all right.
I met Miss Verna at the home dialysis center, and I saw a sign on her car, and I asked her. I said, "Who did your signs?" And she said, "Well, I got them done through this company." She said, "I'll share with you the information of where I got them done through." And then I started seeing her billboard signs up and stuff. Yeah. And I said, "That's the same lady who goes to my clinic." And so on the next clinic visit, we talked again, and we really connected that day. I said, "Miss Verna, I see your signs up." I said, "You are really, really on it." I said, "Miss Verna, I'm scared. I said, because I don't know if people are going to look at me different because I have this. And I said, I'm a very private person. I don't want to put my health information out there to people like that. And she said,
Mm-hmm.
oh, no, baby. She said, oh, no. She said, you can't keep it hidden. She said, you got to share your story with somebody. She said, you have to
Amen.
share your story with somebody and let them know that you need help. She said, this
Mm-hmm.
is your life. You have to fight for your life. She said, if you don't talk to your family members about it and they keep saying that they're going, she going, he going, they going, and they haven't gone yet, she said, it's still on you. You have to do something for yourself. She said, start off with those Facebook groups. Join those Facebook groups. Get in
Mm-hmm.
those groups and just pray about it. Just pray about it. Ask God to deliver you to get the message out there. And I said, okay, Miss Verna. And that really, really, really did lift me up because one from Miss Verna and praying about it, I don't think I was going to ever get out there and just share the story on social media how she told me to.
Wow, great. It
So
sounds like she really was somebody that helped you feel more comfortable
she
with
did.
sharing your
She
information.
did because she just kept emphasizing you have to fight for your life. You have to fight
Let's
for your
go.
life. You have
Mm-hmm.
to share your story. Share your story. And I began to do just that. I started off with the joining the kidney donor wanted page. I
Mm-hmm.
joined that page. I put my story out there. And then I said, I got to get a little bit more deeper in it. I joined the peritoneal dialysis group, started talking to people in their groups, asking them what they did. They made signs, they made t-shirts, they had car decals and all of that. And I said, okay, I got to do that too. And then
Mm-hmm.
I saw a post where Steve had made a post about something. I can't remember what it was.
All
And I
right, all right.
reached out to Steve and I said, I need help. Help me. And he messaged me and he asked me, he said, what can I help you with? And I told him a little bit of my story. And we got connected. I asked him to call me and he called me and I shared a little bit of my story with him. And he said, I want you to get with the Brown brothers. I said,
All right.
okay. I be seeing the Brown brothers making a lot of posts for other people. And he said, I want you to get with them. He said, I think his brother, John, he has a load now, but he said contact Jared. He said Jared gonna be your go-to person. And,
Uh-huh.
and here I am.
Yeah.
Yeah, I mean, I thank God for him, delivering that resource to me.
Mm-hmm.
So,
Yeah, it's
yeah,
amazing how there's so many connections in the kidney disease community, and to hear that, Verna Johnson has, been such an instrumental part of you, telling your story and getting your story out there is wonderful because she's so kind-hearted,
she is.
and
She's
yeah,
smart.
she's a sweetheart. She really is. And, and then there's I know Jeff Hartley, and my twin brother and I have befriended him, and we've been able to give him some of our resources. And then Steve Velcher and I are obviously collaborating, and then to have them refer you to me is a great honor. And just to hear that people would say, please talk to Jared, that's huge, man. Thank you for anybody who says that, and I want to show gratitude because that means a lot to me that people would think so highly of me to do that. But it is an honor to advocate for you. You make it easy, though. I told you your photos. You're so photogenic, Gretchen.
Thank you.
Yeah. But man, I am excited to get your story out there, and I'm very, very happy to do this tonight for you. I'm very happy that we can reach as many people as possible online to get people, to reach new people that have never heard your story before,
Right.
And so many of the things that Jeff, my twin brother Jeff, and I do is that we try to find as many Facebook groups that are connected in and around the kidney warriors that we advocate. So I've actually joined Facebook groups that are connected to Alabama. All right. So if you see me sharing your page, to pages that, Facebook group pages that are connected to Alabama, that's why. Is that, and so we've done that to try to get your Facebook page seen locally. As I try to share in and around not only Montgomery but just Alabama in general, like Tuskegee. I'm probably saying it wrong. How do you pronounce it? Tuskegee?
Tuskegee.
Okay, thank you. Okay. I don't know if I can say that. Okay, but I'm sharing and I'm connected. Tuskegee.
Or either
okay. Tuskegee
or Skegee.
Okay. All right, I'm gonna have to practice on that. But I'm going to continue to try to find as many local Facebook groups in Alabama to try to get your story told so that people in Alabama can see it, they know it, and then as many people that may feel compassionate tonight. Okay, if you feel compassionate enough to help her, okay, if you're not healthy enough to donate, please donate shares. And then if you'd like to donate to me, you can send the money to Steve Belcher and he can send me the money via Cash App, or you can send the money to me and then we'll boost her Facebook page we'll boost it locally in Alabama so that we can make sure that only people in Alabama are seeing the boosted Facebook post from her page. And so these are some things that we can do to show you support, Gretchen. So please, anybody that's watching, it's important that we come together for her cause so that we can kind of amplify this, okay? That we can make sure that we get this seen to new and more people that haven't already seen it. But any shout outs that you'd like to give, before we kind of come to the ending of our show, Gretchen?
Well, I just like to say that I still have belief. I have hope. I'm trusting in God that He's gonna send me a healthy kidney very soon. And I'm hoping whomever is watching this show that they can share it with their loved ones, with their friends, their co-workers, and somebody just come forth to share their spare with me. Like I said early in the show, we can live a healthy life with one kidney. We can.
Absolutely.
So somebody's going to
thank you, my
bless
friend.
me with a healthy kidney soon. And I just thank
Amen to that. Amen to that. We're putting it out there in the universe and God will hear it.